Parkinson's disease is a brain condition that slowly worsens with time. It happens when the brain does not produce enough dopamine. Dopamine helps to control body movement and other neurological functions. Patients can experience tremor at rest, slowness of movement, body stiffness, unsteadiness in their walking, balance, and coordination problems. There is currently no cure for Parkinson's disease. However, therapies and medication are available to control the symptoms, but they may become less effective as the condition progresses and patients have uncomfortable side effects when they take high doses of medications such as involuntary body movement. This is what has happened to Mr. Tan. Mr. Tan was diagnosed with PD 10 years ago, and now his medications do not control his symptoms well. His PD specialist has recommended he has deep brain stimulation, or DBS for short. DBS involves inserting metal wires to a specific part of the brain. The wires are attached to a battery pack that is inserted under the skin. This provides optimal stimulation to the small area of the brain that touches the wires and helps to control his motor symptoms. More than 160,000 people around the world have had DBS, including 200 people in Singapore. It does not cure PD, but it can control motor symptoms and improve quality of life. Mr. Tan is keen to have the surgery, but he needs to undergo several tests before proceeding. The levodopa challenge or on-off test assesses how well Mr. Tan responds to levodopa medication. No Parkinson medication is taken 12 hours before the test, and his symptoms are assessed. Mr. Tan then takes his levodopa medication. If his symptoms improve significantly with levodopa, then he is more likely to respond well to DBS. A physiotherapist assesses his walking. An occupational therapist checks how well he can manage activities of daily living, such as getting dressed and feeding himself. A speech therapist assesses how well he can swallow and speak. Mr. Tan also undergoes neuropsychological tests to assess his thinking abilities and emotion. The neurosurgeon looks at all of these results and assesses Mr. Tan's risk for DBS. Mr. Tan then goes for financial counseling. He may be referred to a medical social worker if financial assistance is required. All these tests will take about 3 to 4 months. The team will review his results and discuss his case. If the team agrees that Mr. Tan will benefit from DBS and Mr. Tan wants to proceed, a date will be set for his operation. Mr. Tan will then go for a MRI brain scan to help plan for the DBS surgery. He will be seen by the anesthesia team to assess his fitness for surgery. They will also advise him about his medications and what he needs to do before the operation.